My name is Ibifunke Kwigbaotemolu. I'd like to welcome you to today's session. Today is a special huddle. We've got a special guest. Dr. Leah Ajayi is a higher trainee in acute medicine. I came across her first when she posted about her success in her PACES exam, which was remarkable considering all the information that was out about PACES and how IMGs were performing. So it was with great pleasure and honor that she accepted the invitation to be a guest on the huddle. If you've never attended a huddle, the Thriving in the NHS huddle is a time when we come together as international medical graduates to share learning with each other so that we can progress in our careers, in our life aspirations. We've had a few huddles this year, and this is probably the last one for the year as we look forward to new things and new ways of engaging with each other in the new year. So without further ado, I'd like to welcome Dr. Leah Ajayi to turn her screen on and we can start discussions.
Thank you so much for inviting me to be part of this. Thank you so much. It's a privilege and honor to be asked to speak. So thank you so much. And also, well done, the great work you're doing for organizing this and everything you're doing towards supporting IMGs. Well done.
Thank you so much. Thank you. So I'll jump right into it with questions because I have so many questions. I can imagine that everybody who signed up, almost 100 people have signed up. We'll wait for them to join. And I'm sure it's because they want to hear from you and they want to learn from you because you've really accomplished a lot and you have such a positive energy and attitude to your work, which is something that as an IMG, it's difficult to keep that level of positivity going. So well done.
Thank you.
So I'll start right at the beginning, your journey as an international medical graduate. When did you recognize the UK as where you wanted to be for your career, and what was that transition like for you? How did you make it? What was your route?
So I graduated from, my medical school was in University of Ilorin, Kwara State. I would say the first time I sort of just knew that, okay, I can't do resident training in Nigeria, whichever way. I didn't know how I was going to go about it. I think that would be when I started clinical posting, maybe 400 level. So, we started with medicine and surgery, where you do rotations and all of that. So obviously when I started, I think, was I in FEM 2? I think it was in gastro. So I had gastro neuro. I had neurology at some point. And, you just go to the ward and basically, apart from just examining patient, having to present, but I didn't really see anything like remarkable that could really stir me up, apart from just reading, going, presenting, but everything was like abstract. On top of that, obviously, like most times you see so many patients dying, stroke patient, bed sores, all of that. And right from that time, I think I told myself that I can never do medicine, that I would never do internal medicine like in Nigeria. So obviously I did surgery. Surgery is all right, but I didn't just like, I was just like, no offense to the surgeons, but I was just like, okay, just doing this day in, day out. The time of trying to prepare the patient for the procedure, the time it to take you to get blood, and then you get there was even a time, maybe there was no oxygen in theater or something like that. Things very ridiculous.
The horror stories.
And then you go back to the patient and say, this is what has happened and all of that. So I was just like, so 400 level, then and 500 level, when we did pediatrics, I really liked because that time we had one of the consultants who had done some of his training in US. So he brought some like dynamic style to the way pediatrics was then. So I really just enjoyed pediatrics. Like we had, M&M, all of that. So I was like, oh, I was going to do pediatrics. But from that early stage on, I was not really sure what's going to happen, but I was just like, okay, I don't really see myself. I don't want to practice. I don't want to do residence in Nigeria. So that was where it started from. Even though I don't know how it was going to come about. So I remember in 500 level, towards the end of 500 level, and then there was this very, very, I don't know, maybe far distance extended relative, or like just came back from US. I was just telling my dad that, oh, let Leah take USMLE and all. So I started checking, oh, USMLE. I was like, oh, there's so many steps, I think that time you have to go to Ghana for the first step and all of that. So I started gathering materials actually for that, filling the form, all of that. But by the time I got to 600 level, there was one of my classmates that I think she was planning to get married, went to same secondary school. And then I think her fiance was in UK, and then she just told me, she said, oh, do you know that, oh, UK, that the license exam is just 2 steps? I was like, okay. So she sent me the links, and I was like, okay, this is actually faster. Even though I didn't know where I was going to get money or how that was going to come about, but that was just already at the back of my mind. I was just like, okay, I have to just see how things will work out. But from that stage, I if you ask many of my classmates, they will tell you, like, from like medical school, like that Leah would just say no, she cannot practice in Nigeria, or she can't do her residence. I don't know how it was going to work out. But I think it's just really, seeing the dilemma, the state of the healthcare sector, and really nothing. Basically, you can't really do a lot for patients. Even though I'd not had the exposure to mental, but of course you watch movies and you just see, what they're doing. I'm like, okay, I have to leave this environment. And obviously, so I did my house job also, University of Ilorin teaching hospital, and during that time I started preparing for my IELTS. Yeah, I paid for it from house job money and all of that. Then did my INYC. So I NYC, then I left Nigeria. That was October 2016. So I would say things then worked out, because also as a female, you're also thinking, oh, maybe if you're not married, what? Because at that time, because we have to be truthful to ourselves. At that time, you are thinking, okay, if you're married, what if the person you want to get married to then decides, oh no, leaving Nigeria is not in my dream, or something like that. So that was one dilemma. But in my mind, I was like, okay, we'll see how it goes. But so when I met my husband, and I think he did this because he's a mechanical engineer. So he did his master's. He was finishing University of Ilorin. That was when I was finishing medical school. So that was when that was when we met. His plan was not really to travel, but I was just, of course, when you're talking, what are your goals, your aspiration, and all of that. But of course, I could just say, okay, this person was focused, and I was just like, okay, we'll see what happened. And I think before I started my house job there, then that was when he just told me, oh, he's gotten a scholarship to do his PhD in the UK. So I was like, okay, so it looks like my path is going towards UK then. And then, also that my classmate already told me, oh, plan is just 1 and 2. So I was just like, okay, it looks like it's UK, that I'm just going to focus on UK. So basically that was it. So I left immediately after NYT. Arrived in the UK October 2016, did my PLAB 1 December 2016, and did PLAB 2. I think that was May 2017, GMC registration. Then started working December 2017 in the NHS. Yeah.
That's amazing. You've touched on so many important things. So the first thing I'll highlight is the fact that the information is not that readily available for someone who is not in the system to understand. So it took word of mouth, a friend trying to dig in before you could get the information about PLAB properly. So it wasn't like there was somewhere you went and it was like, this is the way. So I think that's one really important thing you've touched on. Very interestingly, or serendipitously, we arrived around the same time. But we just took very, very different routes. So I had been in the UK before. I was registered. I had stayed on the license. And then I left. I went back to Nigeria and then got to the same point as you, where I thought, I can't do this anymore. And then I came back. And that actually informed, or has informed, all that has happened, because of that route I took, where I had lived here before, I didn't think it would be a big deal to come back and work. So I wasn't reading any blogs or engaging any communities, trying to figure out how to settle. I just came with my bags and like, yeah, we'll get on with it. And then it was like the system adjusted that mindset. The other thing you've touched on, which I'd like you to dwell a bit more about, is the fact that you came in 2016, but I only saw your PACES exam post in 2022. So that's a 6-year gap, and that's something that we don't explore enough as IMGs. And that's one of the reasons why I do what I do, so that we can shorten that time that it takes us to get back in, in line with where we want to be. So talk about that period.
So, thank you so much for the question. So, immediately after NYC, so I think I got married just, and before then I moved over. So I arrived in October 2016. Did PLAB. I mean, I always tell people, like, nowadays things are so better. There's so many opportunities, like so many platforms where they're willing to assist doctors with funds to do the PLAB exam. So for me, I'm going to tell you, like, during my house job, NYC, all the savings went to preparing for the wedding and just trying to live. So, paying for the flight money and all of that. And of course, my husband was doing PhD. It was not like he was working full time then. So after I paid for Plabon, I tell you there was no funds. That's just the honest truth, and I didn't have support from anywhere. So obviously, I had to wait for almost like 6-7 months afterwards to sort of just try to save money, gather money in the UK. So when I see posts of people that, when you see people that, okay, they've attained this side, but you don't really know their journey, what has happened. I did, like, I will tell you, I did all sorts of jobs just to save money, to gather money for the PLAB 2 exam, and also the registration. So obviously that took like 6-7 months. So I didn't do my PLAB 2 till like, that was June 2017. Then after that, then, the license and all of that. So my first job, I actually got, I think, 3 job offers, but I think I went with the one I felt was the best. So I started working December 2017. So it was a 3-year contract actually that I got. So of course that was your first job in the UK, and it was a very supportive trust, I would really say. And I started working, and my mind was really blown away. So it was in a tertiary, one of the biggest tertiary centers in Manchester. And then I started with stroke, and I was just like, oh my God, the first day I saw stroke thrombolysis, I was like, wow, the neurologic signs are changing. And I was like, okay, this is, so I was really, I mean, I was just like, wow, this is really interesting. So, it will take you a while to settle in. So 6 months, I think I did stroke, ICU. And then that was when, because I didn't really know, like, learning Nigerians, I don't think there was this platform, in the UK. It was 2017. So that was when this IMG group, Facebook group, actually started. So the first, I think it was not yet big. So Omar Alam, who started the group, actually, so we actually all met we had like a get together in Manchester. I was one of the few people we met together, because I was like, oh, it's really nice to see IMGs. And Pascal, you had blog posts. I was okay, it's in CMT, it's that, because there was not really information like now, where you have loads of resources from people everywhere. So I was also like, okay, then I was thinking, what specialty should I do, portfolio. But the good thing was that job was really good. So even my supervisor, it was one like, oh, you have to do poster presentation. So I just collated the data. He did the write-up, submitted it to the conference, got accepted. I was the presenter, but I had portfolio. So it was really good that they were just channeling me to just say, do this is what you can do. And unknowingly, I was just like, okay, this is nice. So it took like a year, for me to just get settled in the system, to then say, what do I want to do? So at that time, I think after I worked 1 year, so I went on maternity leave that time. But I think I already had most things in my portfolio. And then I was like, okay, it looks like I'll apply for IMT. So that I was going to apply for IMT. So I remember going online, reading this Omaland blog. I was like reading it word for word to just say, okay, what do I even need to apply for? Because I didn't really know any other Nigerian that was also applying for the same thing. We had like a PLAB 2 WhatsApp group, but most people were doing GP. So even all the people I knew that finished from my school then, I tried to call people just to ask, okay, why did you apply for GP? What did you like about it? Just trying to compare to then decide. But at the end of the day, I was like, okay, I think I've done a lot that is like towards internal medicine, so I'm going to apply for that. And during that time, IMGs could only apply in round 2. That was the set. It ended on the year I applied. So you had to wait till all the slots were gone. Then round 2, any remaining slots not taken up by the British medical graduates, then all IMGs, you have to compete for that. So I came back from maternity leave. That was in 2018. That was February, and application was February. So I put in my application, did interview. I mean, yeah, it was a physical interview going with big portfolio like that.
Mm.
And yeah, so I got, and then I got the offer. So I started IMT, so internal medicine. So I did that job for 18 months, even though it was a 3-year contract, but I had left halfway, even though I then had to the place where I got the IMT training was, another entire hand. But I was just like, okay, I can't keep waiting because obviously it's round 2. Although they changed it the year after where everyone could apply, but I was just like, okay, I'm going to check the chances. So I started internal medicine training. That was August 2019. So you have to do IMT 1, 2, 3. So it was during that time, during the MRCP exams, there was COVID and all of that, so exams were cancelled. So IMT 1, 2, 3, and really that time I was on social media, but not really posting a lot of educational content because during IMT you're just still trying to say build your portfolio, finish your exams, and just trying to see what's really happening. Then COVID and all of that. Obviously, so by the time I finished IMT 3, so in IMT 3 I did my MRCP 2 and PACES. So it was after I did the PACES exam, because I tell you, IMT 3 you're already like a registrar, but because of COVID, and that was another thing, because having the right information, right resources, it really took me a long time to get around that, especially for MRCP 1. But MRCP 2, I was able to just, read blogs, ask people. Another thing, there were no, I didn't know a lot of Nigerians. Like, I go to the library, you're the only Black person in the library, or you're the only person seeing yourself, because most people are like GP training. So in a way, it was like lonely. I would say, particularly in that area I was, it was really lonely. And maybe in your rotation, you're the only like Black person, or even if you're the Black person, you are the only Black person doing another specialty training. Every other person is GP. So you have to find you yourself. You just have to find your way and
Yeah.
just say, this is what I want to do. So, and most of the consultants, was there any Black consultants? I can't even remember. I don't think, maybe in one of the hospitals, there was just one Black consultant. In most of the other hospitals, all the consultants are Asian. So you can see, yourself, you're just there, but then every other person is there together. So you're like trying to just force your way, fight your way, get things done. So so by the time I did the MRCP paces, yeah, I didn't even have anybody I practiced with or anything. But by the time I then saw my result, I was just like, okay, like I was like, wow. So, and of course, people were there asking me, how did you prepare? What did you do? So that was when I started a blog post. So I just sort of, started writing, then doing medical education content, and of course, people reaching out. And then you see that IMGs, like particularly because a lot of IMGs really struggle with all of this because there's no right information, they don't know what to do. So basically, so that was in 20, that would be 2021, 2022. I think, yeah, that was between 2021 and 2022. So after IMT3, I took like a 6 months trust grade job then before I started my ST4. So yeah, that's why I think from when I arrived in UK till that time, yeah,
So
that's
you said a lot of things that you've just talked about casually, but because of what I do and how I understand how we achieve what we do, I'm just going to spend some time to unpack the things that you said so that people who are on the journey understand the sacrifices and the way to go about things. So I'll start with picking a job. So you said that you applied for 3 jobs, or you had 3 job offers, not that you applied for 3 jobs. You had 3 job offers.
yeah.
Now, it's important to understand that for you to be choosing between jobs, it means that you are showing up at the interviews. It means you've put in the work, you've prepared, and the people who are interviewing you are convinced that you're someone that they want to have on board. So that means that there was a way you were showing up that was the right way, and that's why you could choose. Now, you said that you chose one of the biggest tertiary centers in the hospital in in the UK. And that's important because one of the things you said is that it's a supportive place. So somewhere that is a tertiary center is very likely to have a diverse staff pool And that means that these are people that are used to interacting with people from all over the world. I had a different start because the trust I went to, my department, that was the first time they were employing an IMG from Africa. In fact, an IMG full stop, but then from Africa, they hadn't had someone like me. So it was a very different thing. And it was a DGH in a semi-rural part of the country. So I had a very different start to what you're describing. And as you can imagine, that affects how you start. Now, you talked about the fact that your consultant told you all the things to do to build your portfolio. It's very important to understand that people don't support people who don't show up. So if someone is going to put in the work and the effort to develop you and build you, it's because you're doing something to make them believe that it is worth their time. So you were showing up in a way that made that person commit to building you up. So that's really important. You talked about the way you prepared for the exam and the fact that there was nobody around you supporting, everybody else was doing a GP role. And that's something that's very important to me as well. When I came to this country, it was a big sacrifice because I was pregnant at the time I moved. My husband was in Nigeria, so I was by myself in this DGH doing surgery, and I had made a big sacrifice to relocate at that point. But when I started struggling with, in different aspects, everyone would say to me, do GP. And I understand that they meant well. But it's important for us to understand that if you have an interest in a specialty, the fact that you have challenges does not mean that you have to give up and do something else. It means you have to find the support to get you where you want to go.
Exactly.
So that's what you did. You read blogs, you connected when you saw opportunities, like when Omar Alam had the IMG group, you went. You went. Okay, so you put yourself out. You talked about the fact that there were no other people who looked like you. And the other people who didn't look like you, they got on well. And you put yourself forward to try to get into those, break into them. Those are things that require effort. And it doesn't come naturally to all of us. So you have to put in the effort. And that's, you know, there's a consistent, you're not talking about that aspect, but it's really important to point out the fact that you're consistently putting yourself out there, you're pushing yourself, you're not staying in your comfort zone, you're not complaining about the challenges, you're finding ways around them, and then you're solving problems for others with your own experiences. So that's really important. And I didn't want us to just talk about it casually without actually highlight, because for you, this is just you. This is who you are. This is your life. And you're accomplishing these things and you're taking it for granted. But there are people who are facing the struggles but don't have the understanding of what they need to change to overcome. So I thought it was important for us to just unpack it a bit before we go ahead. I said well done at the beginning. I'll say it again because I know how it feels to be that one person and there's nobody else around you doing what you want to do and you feel like you don't have support.
Yeah, thank you so much. I'm just going to shed more light because of recent, you know, when people reach out to me that, you know, they're really struggling to adapt, to settle in, or they're in a toxic environment, or they don't have support. I tell people in my IMT too, my supervisor was I don't want to use the word, it was like the greatest enemy. Because if your supervisor is like your greatest enemy, then I tell you, like it's almost difficult not to move on. And my MRCP part one, obviously I didn't have that was during COVID. I didn't just have resources. It was a really stressful time. So I did my MRCP part one more than once, although I did my part two and PACES once. But that IMT2, you know, you had your supervisor who is not just in support, he's an Asian, you know, who you want to do a project, you already asked him. And in the meeting when you're presenting, it's like, oh, you cooked up those numbers, you know, how can your supervisor be saying that or saying things like that? So I was just like, okay, I think I need to re-strategize. So I told myself, I was like, regardless of this, I am going to skill train, I'm going to come out stronger. So what I did was I made sure I got enough feedback. In fact, I did much more than was expected for the ARCP requirements. I made sure I got enough feedback from other people. One thing I would say is that as the Nigerians, we are very resilient. That is one good thing I think that is to our advantage. At least if you school in Nigeria or you've worked in Nigeria, you are resilient. I tell you, there is no way you will go or no system where you at some point you're going to find your balance and you're going to thrive. So I told myself, like, this man, I just ignored him. By the time we had the ES meeting before ARCP, he was shocked. He had no choice but to sign me off. So, and then IMT3, I tell people where I did my IMT3. So sometimes when I see people walking in those places and they're like, I worked there and I survived. I was the only IMT3 because every other IMT3, they wrote to the deanery that they were going to leave the training program because that hospital is very toxic. Very toxic. People lose their GMC license and all of that. But for me, I told myself now, because obviously with training, you're rotating every 6 months, 4 months. At that time, I was already commuting like 1 hour drive because my husband was working. It's also not fair on him. Like if you keep moving every 6 months, does he have to be changing? My son was in nursery and all of that. So I was like, okay, there are two choices. For my ST4, I know that I want to leave this deanery. I want to leave this entire deanery because I don't want to do my higher specialty training deanery. Now, there are two choices. Do I tell the deanery as well to give me another hospital, or do I endure and stay in this hospital for 1 year and then prepare to, build my portfolio so that when I apply, my points are really high and I can get a good, I can get a post out of deanery. So I had to go with the choice of just staying for 1 year. So I didn't write a letter to the deanery to change because the other hospital would have meant 2 hours. And of course, you can't commit 2 hours. That would mean relocating. And I was like, it's really not fair on, my husband and the family. So I had to endure. So I was the only IMT3 for that year in that hospital. And initially was really stormy, like the first 1 month, but I tell you, like, I think it just made me better. It made me a better doctor because I survived. I tried. In fact, that IMT3 was when I built my portfolio the most. Like I was like, okay, I'm going to lead this. I'm going to do this. Of course, you're a trainee as well. So if they see you showing interest, you get, placed at the forefront of leading. Oh, there's a national audit. You get put, particularly my supervisor, because some supervisor wants to see that you show interest, that you ask them, okay, this is what I want to do. Are there opportunities? And I just saw him, sending me emails because I didn't even know that he had like influence that much. But there will be national audit. He would just copy me into this email. Oh, can you lead this? Can you do this? So like I was leading national audit, recruiting other doctors as well to say, okay, this is what we'll be doing. I was doing induction for new starters. I was organizing teaching. And at the end of the day, I got like certificate and all of that. So that year was the year I was able to build my portfolio the most. So it was more like turning, what would have ended up really stormy to something that worked in my favor. And that's what I tell people, like, even if you're at a crossroad, you're at a point where things are not working, you just, number one, take a step back, try to say, okay, what is really not working? How is the environment? What can I do? Now it's different. There's some environment you might need to leave there completely, but then you then need to see how long do I have in this space? How can I make things work well in my favor? And what strategies do I need to put in place? And of course, reaching out now, this way you have opportunity, you have so many people you can reach out to. I have so many people that reach out to me. Okay, oh, this is what I'm going through. How can I navigate this? So I just wanted to add that. Yeah.
Well, that's really good because you brought me back to something I missed when I was doing a recap of what you had said. You mentioned that where you got the training number was a big commute, so it was going to be challenging for your family. And that's one question I think IMGs have faced me with. People have turned down numbers because they heard the environment is toxic. People have turned down numbers because it's too far away. And from my knowledge and experience of the system, I feel like even though it seems in the short term that that's the right thing to do, in the grand scheme, with the way the training application requirements change, things are constantly changing, I feel like that's not perhaps the decision that serves everyone in their best interest. So I like the way you've highlighted how good came out of difficult things, because sometimes it's difficult but you have to make those difficult choices so you can achieve what you want to do. So thank you for sharing that. You've talked about some of the things I was going to ask you, so I'm going to move on and ask you about support systems. So one of the good things that we share in common is that we have families, we have young children, we've got um, a different path from the well-beaten path where there's lots of information and support. What would you say for someone who is in this sort of situation early on in their career, just starting a family at the same time or considering it? How important would you say it is to plan your support system around your family and your role? How has having created, or just talk about that rather than me putting
Yeah, thank you so much for that question. I always tell people having a good support system is very, like, it's indispensable. You definitely need it. On the other hand, I've spoken with some female doctors where I don't know, it might be slightly different for male doctors, to female doctors. So, but then I will try to post, I like female doctors then in general. I personally, as a female doctor, if you're going to pursue a specialty that is going to be different from GP, I tell you, you're going to need extra more support from your partner, from family. You're going to need a support system. Apart from that, it will take a bit of being intentional and even planning from your hand. I'm going to put that. So I remember, I'm not saying that's what everyone should do, but what I did. So I remember when we got married, and before we got married, my husband and I really just spoke, and I was like, okay. And even before that, it was like, okay, what's the plan regarding children? And both of us decided that I was going to finish all my exams and actually get GMC registration before we had the baby. So of course, it was until 2 years after we got married, when I got my GMC registration, I started working before that. Because for me, I already know, apart from just both of us, we don't have any other support anywhere else. So it's different for some people, you have people that can support you and all of that. But for us, it was not the case, it was just both of us. And he was doing his PhD, not working full time. And if me, I was not working. So we already just said, okay, this would not be the best thing. So, okay, let's just wait. This was until I started working a few months after that. And okay, now we already have the child. And because of course, childbirth pregnancy comes with its own challenges. During that time I could not read, I was forgetting things, so many other things. Now, after that, of course, then when I got the IMT role and wanted to move. Now, it's also about communication. If you plan to get married or if you're already married, you need to carry your partner along. Either your partner is a medical practitioner or not. If you're yet to get married, these are some of the questions you need to be asking. You need to talk about it. Because if you choose a career that's different from GP, you'll be doing nights, you'll be doing on calls, when you have exam, when you have training, conferences, all of that. Is this person able to support you, when you have children that's able to be hands-on and all of that? Because this is different from Nigeria. That's another thing. You're in the UK, you might not have that much support system. It's different from, if it's in Nigeria where you can just say, okay, we'll drop the child off with grandma, we'll drop the child, or someone will come and look at. Here it is different. You have to, once a child comes into the picture, or children, it changes the whole setting about childcare, about nursery, who stays with the child and all of that. So when we moved, my husband, he had finished his PhD, but he actually, took that sacrifice, and it was like, don't worry, I'm going to move with you. And so we moved, and of course, it took a few months before he then applied, got a job and everything. So, which was why also during training, even when my rotation was changing, my hospital, I was having to commit, because I was like, we cannot keep, so commute sometimes 1 hour drive, each way, because if I then move again, you now have to reapply for another job, which didn't really, I was just like, no. But it's very important. You guys need to find a system that works for you. So for instance, there was a time, I think before my son was born, my mom used to come, then my mother-in-law used to come. That's another thing you can use, trying to invite people. So planning ahead. So my mom, when she comes like 6 months, then my mother-in-law comes 6 months, until I think my son was 2 and he started full-time nursery. Of course, full-time nursery is expensive. I think per month we were paying like £1,300. So we drop in from like past 7 in the morning till 6 p.m. Monday to Friday. Mom guilt will also come with it. That's another thing, for female doctor, feeling mom guilt, oh, your child just nursery. But I mean, at that time, you just have to say, okay, what do you have to do to make it work? So, of course, my husband had more flexible working pattern, like he doesn't do night or weekend. So, I drop off in the morning, he can pick up, or even because you also have to have someone that's flexible, which is why communication is really important. Sometimes they just call you, your son, your child is unwell, you have to pick up the child from school, who is more flexible, that can get time off work. So you always have to have that backup, except you are in a community where you have church members, or you have people that can pick up your child, or help you look after your child. Even with that, one of you really have to be flexible. One of you have to work in the same time where your child or children is in school or nursery, just in case of emergencies. Is very important. If you can keep inviting, unfortunately my mother-in-law has passed away now, so it's just my mom, and it's just maximum of 6 months in a year. So even if she comes 6 months, the other part time we have to plan. So it's about really finding what works for you. I remember, and don't forget, there's this Nigerian mindset. So that time, we're going to the Nigerian church, and of course, on Sundays, maybe when I'm on call or something, of course, my husband goes, takes him to work. He does grocery shopping. He cooks as well. So that's another thing you guys you need to find what works for you. And I remember one day he was telling me that, oh, he went to church, and after church, he was like, oh, he wanted to get something from the store. And that there was this man, he was like, oh, you don't mean you're the one getting stuff, buying stuff? And I was like, yes, like, yeah, my wife has gone to work, like, yeah, we're going to eat. So it's about really, you guys have to work in synergy, because people from outside, of course, maybe most of the other people, that there were a few doctors in that church, it was a Nigerian church we were attending, but almost all of them were GP training. IMT is completely different. Our pathway is different. Yeah, you might not see me frequently. Yeah, it's because I do on course, I do night. Maybe they're in GP posting. They don't do weekend, they don't do that. It's completely different. Our pathway is different. So but people trying to say, oh, you're the one bringing the child, you're the one taking the child to this, you're the one going to the market. Both of you have to work in synergy and really find what works for you. That's one thing. So having a partner that's really supportive, that understands your dream, that is in support of your goals, of your aspiration, and of course you also do vice versa, is very important. Finding what works for you, regardless of what anyone says, is very important. And then, with nursery, or even now that is going to school, I'm trying to find, someone, because of course the school timing as well will not work. Even if you do breakfast club, after school club, sometimes if you're on long days, that doesn't really work. So it's about really just finding, sometimes I think when we moved for high special training, when I moved back to Northwest, so we had to have somebody just in case. So there was a Nigerian one that we used just in case, that if it's on days where we're running late, or something just happens, because obviously there's a lot of traffic that we can't pick up. So we have someone that can always do that, just having a backup plan as well. Or if you have friends, so some people, they do shared, carpool and pick up and all of that, or after school club and all of that. So it's just really finding out what works for you, but having that support system is very important. If you have your mom can visit, your mother-in-law can visit, you have sisters-in-laws that can visit. There was a time we invited my sister-in-law and all of that can visit, to also help buffer during that time, is very important. Because by time on weekends, some weekends when I'm up, particularly before I did all of my exams, I'm like going to the library trying to read, because of course I can't read at all. So it's about you guys, you really, if you're married or planning to get married, this is some of the very important conversations you need to be having, and making sure that you guys are in sync, you're in synergy, you know what really works for you, regardless of what other person is doing, because your journey is different, your pathway is different. You cannot compare with another person, and really finding what works for you. Yeah, that's it.
Thank you for sharing that. I think one of the things that you said that is important, and I think to largely, even for GP trainees, particularly when they're doing their hospital rotations, you'll find that a lot of these things are common. And for those of us who are IMGs that come from countries where family is extended and large, I think that's a resource that is very vital. If you're a single parent, single dad, or single mom, it still applies. These things still apply. You need to have a system, because if you don't have a system, it falls apart very quickly. And I think one of the things about having a system is having a backup to that system. So if that system fails, there's the next thing in line, because otherwise you get very, very stressed. So you've talked about the PACES exam. What I'd like you to talk about now is how you now support people to pass the exam, because I know you have an effort for that.
Yeah, yeah. So thank you for that question. So the MRCP PACES exam is like the last or the third part of taking the membership of the Royal College of Physicians exam. So you have the MRCP part 1 and 2, which are, multiple choice questions, and then you have the MRCP PACES exam, which is an OSCE based, practical exam. It's quite a very thorough and intense exam. Even statistics particularly will tell you the pass rate of international medical graduates and British medical graduates, and very, very, when you see the statistics, you will just see that, for instance, I think the statistic from last year is saying only 20% pass amongst international medical graduates compared to British medical graduates, where you have 60% pass. So you can see the stark difference in the statistic. So obviously, before I did the MRCP exam, you've heard so many, people do it once, twice, several times, and you just really hear so many scary things about the exam. And yeah, I remember, because I was in IMT3 and I know that I had to do. So nowadays, before you do IMT3, you must pass the exam. Or before you start your higher specialty training, you must complete all the stages of the MRCP exams. But during that time, because of COVID, so they allowed, even if you had not done the PACES exam, we all moved from IMT2 to IMT3, which was equivalent of CT2 to like ST3. But I knew that before I finished, I had to do that exam. I was really scared. I was just like, oh my God, like, what is going to happen? Like, so many people, they will tell you they've done the exam more than once. And then, so I was just like, okay, what am I going to do? I tried to read so many blog, read online, but it was just difficult. Of course, I was doing the IMC3. I didn't have anybody to practice with. So I was just like, okay, what can I do? And I had a very limited time. I was going to finish IMT3 in August, and ARCP was due then. So I had just like, I'll say 4 months, to just do that exam, and either pass it once or be at the risk of my program being extended, or them saying, oh, you can't be released from IMT3 because you've not finished the exam. So it was a very stressful period. It was a lot of pressure. I'm just like, okay, what am I going to do? So obviously, I just tried to read resources. I booked for the courses people said. I went there, and I just developed a personal strategy for the exam, and I prepared and passed the exam. And after I did pass the exam, and because it then became, I could now see why IMGs, will struggle, particularly with that exam. So it's an exam where, number one, your communication skills are expected to communicate at the level of a British medical graduate to like a British patient. How you convey empathy, how you come. So it's not just the clinical aspect is there, which ideally you expected to have, but it's more on the profession side, the communication side, how you do things. Of course, all your examination, you need to be slick in how you can examine your cardiology system, respiratory, neuro, everything, within 6 minutes and arrive at a diagnosis. So apart from being a very time and bound exam, is an exam where so many things have been, looked at the same time. And I could really see why IMGs will struggle, or those loopholes, or where people, if you're not really intentional to say this is how you prepare. So after that, I started like one-to-one. So people just reaching out, oh, how did you have this score? So I started my blog post where I sort of just did like a write-up of how I actually prepared for the exam, resources that I used, and all of that. And I started like one-to-one, people reaching out. I do like, I was doing tutorials over the phone, just trying to examine people in my hospital then as well, doing some bedside teaching. So that, continued to, I think, September 2023. And then there were some other Nigerian doctors as well who had done their MRCP exams, who were already doing it as well. So we all met online. So there in the UK, you know, people were saying, okay, if you want to prepare for PACES. And some people that had done tutorial for also commenting, saying, oh, Leah also does teaching this one. So we all came together. So 5 of us all came together and we started like the ACE Academy. So where we do, where since last for over a year, we've been delivering weekly PACES teaching, about 2 hours teaching every week. And then we then graduated from that. We do monthly courses, we do master classes as well. We do mocks. And I tell you, like our mock exams have been IU'd. We've had, you know, several cases where people go to exam and it's exact word for word, you know, all the stations they get. It's just because we've gone through the system, we already know this is what happens. This is how you can prepare for the exam and actually pass. So that's what we've been doing, and we've had remarkable success rates. We even published one of what we've been doing in the Royal College of Physicians journal. That was last year. So we had a presentation that was published in the Science Direct journal as well, where we're just talking about, you know, what we've been doing to just bridge the gap, you know, just increase the success rate of IMTs and PACES exam. And beyond PACES, we've also been supporting people with the MRCP 1 and 2 exam and general just career development in internal medicine. So for instance, last year we had sessions where for those that were preparing for IMT, you know, we had Zoom session where we talked about how they could complete the application, also how they could prepare for interview. We even had mock interview sessions for people, and we had very successful, you know, we had people having 80/80 in their interview scores, and quite a number of people that have gotten into internal medicine training. So just that's what basically we've been doing, and now we're open, yeah, to just continue that good work and even do much more than that. Yeah.
That's amazing. Well done.
Thank you.
So I'm going to highlight some things you mentioned. So one of them is the fact that you came together with other people. So I think that's working as a group is a very powerful thing.
Yeah.
But also the fact that you've taken the information from that and you've been able to publish it.
Yeah.
So that goes to build something else. That builds research capabilities, that builds your portfolio and stuff. So it's important, like the efforts that you put in, you make sure. I always talk about the Pareto principle. 20% of the efforts should yield the benefits you want 80% of the time, rather than 80% work, that 20%. So you've already done the classes, you've already done all of that. You don't need to reinvent the wheel trying to find some new research. Just take what you've done, put it down, put it together, and then you can put it out. That's really good. Thank you for sharing. One of the things that I see on your social media, I talked about this at the beginning, is when you share about your work and how much you enjoy your work. I want you to talk about training. So first, if you could start from how you prepared for the interviews, because the training interviews tend to be like exams. So personally, how did you prepare for the interview so that you were successful? And then when you got into your training, what did you bring into it from your previous experiences to make sure that your training was yielding what you wanted? Because at that stage, you're now very experienced, you understand the system, you faced challenges. How did you sort of approach it? Because the challenges will always be there for IMGs, the way people behave, all these things, the system. What is your unique way that you're approaching this that's making it different for you?
Thank you so much for that question. So for interviews, I did the write-up as well, my blog post about how I, you know, got my ST for Acute Medicine training number. So I sort of also wrote about how you can prepare your portfolio, which is also applicable if you're preparing for internal medicine training. And particularly for the interview, there's a section I did for interview. So there's some books that you could use for interview. However, it's beyond that. It's about how do you convey that information. So I used to tell people, like, I was an extreme introvert. I know you might be surprised. Like, I was an extreme introvert, very shy, did not used to like to talk. Like public speaking was a huge problem for me. But I think when I moved over to the UK and I saw the system and I saw that you can't keep quiet. If you keep quiet, they would assume you don't know. They would assume, okay, you're just there. So, and then I would see some people just say something, I'm like, that, but that doesn't make sense. But then because they've spoken, so they will be recognized. And then just based on that, of course, I try to just volunteer, just do teaching, get feedback, regardless of how it is. And then you start getting feedback, and I'm like, okay, I didn't know I had this quality, and then just try to build upon it. So I would say most of my journey so far, most of them has been self-directed or self-motivated, because I tell people, you determine the type of trainee you want to become. You determine the type of doctor you want to become, particularly with the way the UK training system is, maybe compared to Nigeria, where they are grilling you, they're asking questions.
Yeah.
In the UK, it's not really like that. So, you will see some consultant that will really ask you, but then otherwise, most people are just going with the flow, the guidelines, the protocol. But then I remember by the time I became a registrar, I told myself, I know the type of registrar I want to become. I don't want to be a type of registrar where, I get called to emergency and I don't know what to do. I can't give instruction, or I don't have an idea. So of course, that really motivated me to start doing a lot of self-directed learning. So aside the exam, because obviously the exam itself will allow you to, read widely, get more knowledge. But then about really fine-tuning my ECG skills, my, chest X-ray skills, my CT skills, all of that, just reading widely. So, I'm reading articles, I'm reading, oh, what's the latest guideline with this? What is the latest guideline with that? How is it different? Or then I do a lot of self-reflection. So if I see a patient, I keep tab of that. I go and check,
That's
later.
amazing.
Maybe if there's a post-it, I go and check. Although now this is sometimes, some consultant, we just copy word for what you've done. But sometimes, especially when I start at the early years of becoming a registrar, so I go back, I try to see, okay, was there anything different in the examination? Was there anything different in the approach to management? Was there anything, what happened? So that way, I then see, oh, if there's a difference, then I like, okay, next time this is what I can do, or then look it up, because that is the way you learn. And before you know it, it's just about, the cumulative effort, the cumulative knowledge. You don't have to spend so much time, but I think reflection, is very, very important. You've seen the patient and maybe you are not really sure. You are not sure, okay, oh, what's the diagnosis or what's presenting complaint? And then later on, you see, oh, this is what has happened. And you're thinking, okay, what did I miss? Then you start taking a step back. If you're not sure, you just quickly read it up and say, okay, because next time, if you see something like that, then you already know it. And then you'll be able, you'll be more familiar with that process and with that concept. So, I mean, I was trying to, I maximize opportunities for teaching, for, trying to do induction, for public speaking. I was just, trying to force myself, because I knew that my my base, I would say my default status was being an extreme introvert. So I knew I had to really push myself for me to get to that point where, I go to interview, you ask me a question, even if I've not prepared for that question, but I can answer you, because I already know, number one, this is what they want me to say. This is how I can stand out. This is how I can put my answers together, for the best outcome. So, like for instance, that interview book, I went through all of them, and like I already had answers. Like I tried to draft answers based on all the questions that were in the book. For instance, tell me about yourself. Tell me about yourself. So candidate ABC will answer that question differently, and they will get different marks. So tell me about yourself. I go through, oh, how have they answered it? I try to then say, okay, how can I answer that in my own way? Oh, for instance, tell me an example of the time where you've been involved in an MDT and you've played a major role. Now it's about really knowing what exactly, how do they want you to answer that question in a UK setting as a trainee, or depending on your level of training. So that was the way I was able to just prepare for those interview, and then I go to the interview. Of course, it's time, and they ask you a question, and of course, you are then able to sell yourself, because in the UK, it's about how you can really, talk about what you've done, what you're going to do, how you can make a difference, or how you can convey your thoughts. That's what will really make a difference in interviews. So that was part of the way I was able to prepare for the interview. Now coming into training, as I've said, Nigerians, what really works well in our favor, we are very resilient. That's it. We are very resilient. However, one thing is you would always get to an environment, particularly if you don't know you, there's already a bias. I always tell people a bias towards Black doctors that, oh, maybe they're not good, maybe they don't know what to. And I tell people it's normal. You would sense that, you will feel that, but that is not your concern. Your concern is to do your work and let your work speak for itself. So, which also take me to the part of you have to say, okay, I'm in this specialty, I want to be really exceptional. I want to be outstanding. I want to know what I'm doing. I don't want to be a case that I'll be like, okay, well, I don't know. I want to know that, okay, okay, you see a patient, just okay, I know this is the question I'm supposed to ask. I know this is how I'm supposed to work up this patient. And I know this will be the differentials. So that your work etiquette, will speak for itself. They will be like, okay, and this person is really consistent, this person is intentional about the job, and they will accord you your respect. So in the first few months you get to a place, they look at you. For instance, like when I started for, of course you see some other, they'll be like, okay, this is a Black registrar, really I just do hello, hi, do my job. And before you know it, later on they'll be like, oh, they go through your notes, and then you start getting feedbacks. Oh, we really like how you manage this case, how you do this, how did you do that, how did you do that, because you've really worked on yourself, you've been intentional about this whole time, and just say, I really want to just be a good doctor, I want to be a good surgeon, I want to be a good, like if you're in surgery, for instance, I know some people take year out, they go, like if I'm maybe general surgery or something, they go to like South Africa a year. They want to make sure they have hands-on skills that, by the time they come back, well, the surgical maybe procedures that other people will be scared about. No, you already know how to do it. You'll be like, yeah, this is how we're supposed to do it. This is what the latest research is saying. And that way they will accord you respect, but you've actually paid the price for that. So being intentional is very important. Reaching out to people, speaking up early. Nowadays, you have so many support systems, so don't be scared. Let your work speak for itself. You don't have to you treat everybody with respect and all of that, but let your work speak for itself. As a Black person, you walk into a place, it's normal. I tell people, they might look at you and say, oh, this is a Black person, do they know what they're doing? It's not your business. You do your work, and your work will speak for itself. Of course, if there are cases where you feel, there's subtle racism and all of that, there's channels to report that. Or if there's workplace bullying and harassment, there are always channels to report that, and which is the good thing about the system, that you can always report people. So when I started, as a registrar, I come to work, I do my work. Obviously I keep saying it that my IMT was I would say was a huge turning point for me in my role as a registrar, because where I did that job was really stressful and busy. There was a DJH, you are the only registrar covering the ward, covering acute. Also, we were doing stroke thrombolysis. So I was always on my feet. But because of that, I had to learn so many things. You're the one everyone is calling to make decisions, and I had to just read so many things, and had to, develop skills and all of that. So by the time I now come to an environment where, it's well supported, and all of them, sorry about noise, there's a lot of construction going on. And sorry.
Don't worry, we can't hear it loudly. Don't worry.
Oh, okay. So by the time you now come to the place, can you hear me?
Yeah, we can hear you. There's a bit of an echo now.
Okay.
So by
the time you now come to the place where there's much more support, you're going to shine. You just see that you really succeed, but you've actually paid the price. So I always say that you have to be intentional. You have to put in the work. You have to reach out to people. Because there's no pain, no gain, no pain. You have to really put in the work and just say, I don't just want to be like, every other person and just say going with the bare minimum. No. What will really make me stand out? Is it going to be my clinical acumen, my clinical skills, showing up to work, making my work speak for me? Yeah.
Thank you. So I think we're conscious of time, because I know you have another engagement. So I'll ask you to give what would be your take-home advice from today for everyone? And I know there may be non-Nigerian people here as well. So your take-home advice to everyone, and then we'll have a 2-minute interlude where I'll talk about thriving in the NHS and give you the opportunity to provide feedback to Dr. Leah, because we really appreciate what she's done for us. And like we said, you have to use one effort to achieve more than one thing. So this feedback will go in her portfolio. So please be
thank
kind
you.
and take the time and fill out the feedback form. And then we'll take some 10. Are you still okay for 10 minutes?
Yeah,
For
I'm
questions?
okay till 12:30. Yeah.
Okay, so we'll take your sort of thoughts that you leave with us, all of us. And I have to say, I've learned a lot, because some of the things you're saying are applicable even to me at this point. So thank you.
Oh, you are. If you can just let me share your screen, I actually did like make the slides, so which I
Okay.
think will just summarize most of
Okay. So
the major take-home points.
just give me 1 second to sort that. I'll need to make you host. So just give me one
Oh,
second.
okay.
All right. Actually, while I'm doing this, let me just put the feedback form in the box so that everyone is doing that while we're setting up. So please fill out the feedback form while we're setting up, so Dr. Ajayi can share some thoughts with us.
There's just some comments in the comment section. Dr. Abiodun, thank you so much. Dr. Janet asks, family planning around training is something I'm unsure about, and I'm F2, no marriage. So obviously it has to be something that you discuss with your partner and just say, okay, what's the plan? For some people, if you have enough support, if you don't have to wait, some people, would decide to have children now and then continue the training or take time of training. Nowadays, you can go less than full time. There's a lot of support to if you have family or if you have a reason. So I think it's just really about communicating first with your partner to be and just say, okay, what can we do? But don't be scared. There are a lot of people that will be like, okay, if you start the contraceptive, this will happen, that will happen. There are a lot of options nowadays that you can always just speak, with your GP, and they can always refer you if it comes to that time. Yeah. I'll just quickly share the slides. So I think we've talked about this. So basically, I just did the slides basically because if you're looking at the theme of thriving in the NHS, some practical steps really. I can always share the slides afterwards, but the first thing will be understanding the system is very important. You need to be familiar, with your departmental trust policies before starting a rotation. Ask questions. That's what I used to do. So even before I start a rotation, I'm trying to, if I know a training that's gone, I'm like, Rita, oh, how is the rotation? How were you able to maximize training opportunities? What clinics would you advise to attend? If you need to get sign off procedure, what are the procedural skills they do? What are the opportunities? So you're already asking questions so that by the time you start, you're like armed with the resources. You already know, oh, which consultant is in charge of research, which consultant is in charge of QIP audit. You reaching out, you're sending out email. Oh, I'm Dr. So and so. I've just started this rotation. Oh, I would just like to ask, is there any ongoing research, any ongoing audits I would like to be part of? So you're already starting that by the time you start the rotation. Shadow if you need to catch up. This is one thing I did, when I started my first job in the NHS. I used to go on some weekends that I'm off. So I identified some people that were willing to really, explain things. They were Asians about the system. So when they're on call, I go to them because I think for the first 2 months I was not on call, but I was like, okay, by the time I start on call, I don't want to be asked, how do you do this? And I don't know. So I used to reach out to those people. I'll just say, when you're on call. So I actually go maybe 2 hours and then I shadow them. I just say, okay, I'll come and shadow you. So if you need to catch up, shadow. If you think, okay, I'm not too sure what's really happening, or I don't know how to do this, once you have identified people that can actually explain things to you, try to shadow if you can. The language and culture is different. Yeah, it may take a while to adapt, so don't beat yourself up. The cultural lingo, the communication, it will be different. You need to know what you're eligible for. So if you're a non-trainee or even training, you're eligible. There's study leave, there's study budget. You should have supervisor, you should have portfolio. So it's about acting on time and just say, okay, even though I'm in a non-training post, what are the things that I'm entitled to or I can get? You know, people always say, okay, this is how you do it. You can always get a portfolio, even if a non-trainee, and that will go along, because that was what I did, because that would just help you build things. Familiarize yourself with the NHS structure, because I think the frustration for most IMGs is not understanding the system, not understanding the structure or how things work, you know, how the department interact, patient flow, administrative procedures, because that can really reduce stress. Yeah, cultural sensitivities, there are a lot. So you need to know that, you know, of course, even up to now, there's still some, you know, some accent of some part of UK that, you know, I'm like, what are they saying? Or there's some terminologies they use. It's just a joke to them, but I'm like, okay, I don't really understand what you're saying. So there'll be cultural sensitivities. Mentorship is very important. And I think that's why platform like this is really good. You also have the NDUK IMG groups. Reach out nowadays, you know, with social media, you can always search, you know, doctor UK. You will see so many people, and you can check, you know, which specialty are they. So find someone that can mentor you early. Is very important. You know, if you're thinking of going to surgery, you're thinking of going to ONG, you can think of going to PEDS, you're thinking of going to internal medicine, reach out early, you know, so that I say, okay, I'm trying to do this. And then, oh, how can you, you know, can you just give some advice? What do I need to do? Or this is what I'm planning to do. Mentorship goes a long way. Ask questions, seek help early. And also try to pay it back. You know, you also have IMGs, try to return the favor and just say, okay, this is how you do things. You need to have a personal development plan. It's very important. Either you're training or non-training. And they have to be specific, measurable, achievable, relevant, and time-bound goals. If you don't know how to go about it, speak with people. You're in a non-training post. You're not even sure, okay, what do I need to do? Or I'm just working and nobody is talking to me. Reach out. You know, you can have a personal development plan, because it might be, okay, you want to apply for IMT maybe next year. Okay, my personal development, that will mean, okay, I'm going to do an audit or complete a QIP. I'll attend a conference. I'll try to do a poster presentation, all of that. But if you don't know how to go about it, and you don't have a personal development plan within time frame to say, okay, in the next 6 months, this is what I'm going to work on, and this is what I'm going to do, then you just see that the 6 months are passing, you're not even sure what has happened. Speak with someone, have an EAT portfolio. One thing when we're in Nigeria that we didn't really do is to gather evidence. Many of us, we've done so many things, but because we don't have evidence, then there's no way we can show it. But that, which is why an e-portfolio is really good. If you're not training, most time, your trust, you can have some study budget allocation that for which you can have an e-portfolio. So it's like a record of things. There's so many ways to navigate it. You can always still reach out if you're not sure about how to go about e-portfolio. You need to sync your academic goals. If you're non-training, then you have appraisal. If you're training, you have ARCP. But even if you're not in training, you can always plan with the person specification. So if you're planning to apply for a specialty, look at the requirements, because based on that, you can set your goals. You need to set short and long-term goals. One thing many people ask me is that, how did you manage, you know, to apply for a 7-year training program? And I just say, I take it 1 year at a time. That is it. Because the long-term goal is to be consultant in acute medicine. But the short-term goal is that each year to complete my ARC, to complete the training requirements. So that is my short-term goal. Or the short-term goal to say, in the next 6 months, while I'm in this training, to do this, to achieve this. That's the short-term goal. Because if you get overburdened by the long-term goal and say, oh my God, 7 years, you won't start anything. And now when I tell you, okay, I'm about finishing ST5, I only have ST6 and 7, I'm like, oh, it feels like yesterday I've started. So it's about taking it one step at a time. You need to set a mix of achievable short-term goals. You know, for instance, I want to do these exams, I want to do this audit. And that will really just help you. You know, you're checking, okay, what have I done? Oh, I said I will do this in the next 3 months. I said maybe in next 6 months, I want to do MRCP1 exam. Okay, how am I getting on with that? So it's very important. Engage in active learning opportunities. Participate in grad round. In any unit you are, most units will have mobility and mortality. Most units will have maybe weekly teachings or monthly teachings. Volunteer yourself, you know, reach out to say, oh, who is the consultant, you know, in charge of the M&M? Say, oh, Dr. So-and-so, I would like to participate. They will say, okay, can you present, maybe do the M&M, gather information for this, present it. Don't be scared. That's the thing. Don't be afraid to make mistakes. Don't think, oh, they will think I'm saying rubbish. No, if you don't put yourself out and try and get feedback, there's no way you will know which areas to get better. Attend grand rounds, case reviews, seminars. There are a lot of opportunities. Get involved in organizing and delivering teaching sessions. Most specialty application will tell you evidence that you've been involved in organizing and delivering teaching session for 3 months. A very easy way to do that is through your departmental teachings, or in your hospital. If you're in the department that they do induction, volunteer. Okay, I'm going to be doing induction for new starters, and you will get certificates at the end of it. Contribute during discussion. Staying silent is not synonymous with showing respect. This is a Nigerian culture. This is not what entails here. You need to be able to contribute meaningfully. If fine, it's different if you're not familiar with the subject, but try to read it up. Or maybe you're going to have a teaching, they're going to have M&M. Try to read it up before that time, and so that you can contribute and just say, okay, I read about this. Yeah, you contribute. People will listen. Get involved with audits, QIPs, research. You are in a unit. If you don't find out, you won't know what's going on. I tell you, you would not know. I remember my previous rotation, I wanted to do a publication. I basically did most of the write-up, but of course we needed a consultant. And the next thing the consultant was like, oh, can you put so-and-so's name? I didn't see the person throughout, but of course, that's what I'm saying in terms of when you have representation in places, because this person, okay, was an Asian consultant, and this other person was an Asian doctor, but of course, because he was the lead consultant and he had the power to say, we should include this person. So if you don't know, and then you finish a rotation, you see that, this person has been involved in research. This person has been involved in this. How did this person get this? So you need to ask question and say, which all these QIP is going on? And even if there's none, you can always do audit and QIP yourself. So use case studies and practical experience as learning tools. I've already said that, reflect on cases, journal your experiences. So you don't have to put them into your portfolio, but have a way that you can reflect on things. CPDs, participate in CPD programs. There are a lot of workshops, a lot of learning modules, attend conferences. Part of the things in specialty application will be commitment to specialty. Which conference have you attended? There's so many conferences, for instance, just £50, £60 that you can always attend and claim back. And these conferences, there's some conferences where if you submit an abstract, you'll be surprised that when you go to conferences and you see the poster presentation and you see some topics, you'll be like, okay, so they accepted this. So that's why you need to submit, because you'll be surprised that they will accept your abstract. Even if you don't know how to write an abstract, I've had people always reach out to me and say, okay, I'm not sure, I'll say this is what you should do. I'll go through it and just say, okay, before you submit it. And then you get a case report. There's some conferences where if your abstract is accepted for case report, they also publish it. So it's like using one stone to kill 3 birds, because you already have poster presentation, you've presented, and then you already have a publication. You can always submit a case report, audit, QIP, or seek feedback. That's the one thing. Don't be scared to get feedback. So I remember when I was in non-training, I used to draft Google feedback forms, or even now, if it's like I'm doing the teaching that, okay, maybe I send from my portfolio just feedback from consultant, but I want every other person, I draft feedback, Google feedback form. After the teaching, I send it to people, get their feedback. What went well? What can be improved upon? Don't be afraid to put that part where what can be improved upon? Which area did you like best? What can be improved upon next time? Because that way you just get better. You need to establish a structured reading routine, a structured study routine. Maybe once a week or twice a week, you subscribe to BMJ or some journals, and you're just checking, this is because you get updates. You say, okay, the latest guideline for management of asthma, COPD. I think some of the, if you have the doctors.org email, there's like weekly quiz where they just send and all of that. Create a study plan, because that would also mean, do you have an exam? What do I need to do? Because then you can always create a study plan. Leverage your apps and tools. This is the UK, or like in Nigeria, where people are like, oh, why is this person checking? But you have your up to date, you have Medscape, you have BMJ, best practice, so many things you can check. You need to plan ahead. If you're planning to take any membership exams, plan ahead. When is the next exam? How many times in a year do they write it? How much time can I have to devote for reading, for studying? Is it daily or weekly or weekends? Know the relevant materials you need. You need to break down complex topics. maximize learning. Sometimes you might not have so much time to go and sit at a spot and read for 6 hours, but on your phone, can you download the app, the revision app as well? Maybe you're just at home, you're sitting down, you can just review and go through questions. Nowadays there's so many ways by which you can just maximize learning. Stay organized, use a planner. You want to track your shifts, your study goals, your activities, how you can manage stress. Or if minimize activities that don't add value. For instance, I know it's a social media age. Even I'm active on social media, but I put time limit. So I have timer that's like reminding me, and just say you spend so and so time, online. So then I know, because that's the limit I've set for myself. Or on days where, if I'm so busy, of course I can't, if I'm not online. So you might need to set time usage limit. Prioritize rest. You need to having good rest and good health is very important, if you want to stay sharp and resilient. Yeah, leverage technology for academic growth. When I was preparing for PACES on YouTube, so part of the things, of course, you should be able, cardiology exam, to say, is this a diastolic murmur? Is it early diastolic? Is it mid diastolic? Is it pan-systolic? Is it ejection systolic murmur? And no one will really, except you've gone to a medical school in UK where they already have those incorporated into their medical curriculum. But if not, most times you have to work it out yourself. There are a lot of videos on YouTube, like I used to Google, how to differentiate this, how to do this. When I prepare for PACES, I kept listening to it. There are a lot of podcasts, there are webinars, almost anything now, any topic, just search it online, you're going to see answers. There are a lot of online medical communities. Reach out, connect with people. You have conferences. For instance, we had the last Mansa conference. People came, they were able to do abstract presentation, and it was an international conference. So people that presented, they got points for that. So reach out, connect with people. You go for these conferences, you see, this Black person, or in this specialty, you connect. There's so many people that is doing conferences that I've met them, and since then, we've been talking. So many of them are like in internal medicine training now. So it's about really just reaching out and connecting, attending activities that you think will help. And get in touch with your library. So your hospital library, you have access to so many things, BMJ, that you don't have to pay for. There are a lot of NHS e-learning modules. There are a lot of specialty focused medical podcasts as well, that can help. Always just be, communication is something that I just really struggle with. You can attend communication courses, because most times the areas where I just get complained about, when you look at it, it's not really about the clinical skills, it's about communication. They might be like, the doctor did not listen to me, doctor did not do this. It's because obviously the way we communicate will be different. So it's about really understanding that there'll be various cultural background. And one thing, the way I learned was before I became a registrar, when I go to clinics with British consultants, I see the way they consult, I see the way they doing breaking bad news, I see the way they're talking, with patient, and I'm like, okay, and you just start picking cues from that. Build collaborative skills, be in the NHS MDT approach is really key. That's unlike in Nigeria, everyone, you're not looking down because this person ACA or this person is nurse. No, it's an MDT. Treat everyone, cordially with respect. It's very important. Be humble. I'm not saying they should ride you over, but this mentality, like in Nigeria, I am the doctor, I've arrived. Yeah, you're the doctor. I'm Dr. So and so. I'm doctor on the ward, but be humble, be nice to people, even though it's not everyone that be nice about, but really just have a cordial relation to everyone. You doesn't have to, they don't have to be your friend, but it's about just work etiquette, and just be nice. I just put, a slide for specialty application to say you need to start early, reach out to others, be familiar with the specification. I put some useful resources. There are a lot of, I did a write-up on my blog post, how I got my training number, and like it's quite detailed about how you can also use that to apply for, IMT or specialty application. The person specification requirement, if you don't know how to go about it. And I've just put about the MRCP exams, useful website, where, and even my blog post I wrote about that. I'm just sharing a screenshot of, some of the multi-source feedback I got. there's so many, but this one was really unique because I'd only worked in that rotation for 2 months. And for some people, I only worked with them once. But because I rotate in February, so my rotation is out of sync. So normally you rotate in August and you do ARCP in June. So you have like 7 months. But for me, because I rotate in February, so within 2 months, I had to do everything every other person would do for 7 months within 2 months. And that meant I'd only work with so many people just once, and I had to send ticket. And I sent it to them because I'm like, okay, I know your perception about me. Although some people say, okay, we've worked with you, is good, but this way is anonymous. So if someone wants to really backstab you, they will do that through your multi-source feedback. So I was really surprised because some people I only worked with them once, and I sent it, like I sent it to everyone, and within few hours, almost all of them filled it. I was like, okay, this is really surprising. And yeah, you can just see some of the comments, which is just to tell you that as a Black person, like, you can always, stand out. You can always excel in whichever specialty. It's about just being intentional, being focused. And this one is in my most recent trust that I received. This is just like an excellence report. Yeah, I was just going about my normal job, of course. All my uncles are usually busy. I think it was a night on call, and some of the senior nurses I worked with, I think advanced nurse practitioners or something. Yeah, put in this report. I was really surprised, just sent it and just said, this was an excellent report. Which just is just to tell you that, as a Black person, regardless of your color, regardless of anything, you can always stand out. You can be excellent at what you do, and you can strive and succeed. And really, the sky is the limit. Yeah, thank you. Oh, I think you're on mute. I'll just unmute. If you're on mute, I think you have to unmute.
Thank you. Thank you for doing that. Actually, it was very necessary at the time. So thank you to everyone who has been here. I've had a quick peek at the feedback form, and I've seen that only about 7 people have completed it. I would be so grateful if you would take the time just to give Dr. Ajayi some of that love and energy that you've had in the comment section. So there's still time to do that, because I'll just quickly share the the information about thriving in the NHS. To be fair, when Dr. Ajayi was speaking, it was almost like we had planned it and she was advertising on our behalf. Because quite a few of the things that you were saying are quite they're quite topical to what we're trying to achieve. Can you make me host again, please?
Oh yeah. Yeah.
Thank you very much. Okay. So let me see. All right, we'll start taking questions just now. And I think the first question, let's see if there's a question in the box. There's thank you. People have commented on how intentional you've been and have said how good this has been. Someone wants to know, what are the other pathways to higher medical training apart from taking the IMT route?
Yeah, thank you so much for the feedback and the comments. Yeah, the alternative route to the IMT. So obviously it means that, so with the way, before you can apply for higher specialty training, ideally they expect you to get signed up for competencies in IMT3. Now, there are 2 ways about it. If you are in a trust where there's so much support, you can always speak to your supervisor and just say, I'm planning to, for instance, maybe you want to plan to apply for ST for Acute Medicine or ST for cardiology, and just say, this is my plan. Now, what that means will be that you need to first do, there's some compulsory rotations that you're expected to do. So ICU and geriatrics are compulsory. Now, some people, if they have evidence, they can show that they've worked in their own country. I know some people that they've done ICU rotation or geriatrics in their own country, and they're able to discuss with their supervisor, and their supervisor is able to say, oh, this will be sufficient, for what is required for your application. Then you don't need to do it. Whereas I've seen some people whereby they are able to create rotation for them to rotate through those compulsory rotation, and then procedural skills that needs to be done, clinics they need to attend, and then during that time doing the MRCP exam. So this route might take it might be a slightly unconventional, because you have to be the one at the forefront together with your supervisor to say, okay, this is how we're going to draft this pathway, so that at the end they can sign the alternative competency form, which you will now use, because then that means they've signed it and say, okay, you are the level that you can apply for ST4. And also that means you've completed all your MRCP exams during this time. So I tell people that, except you're in a trust that is really supportive, or that you have a supervisor that is really supportive, that can support you towards achieving that. Otherwise, it takes people longer. So I know people that have been on this path, on this other pathway, say for 3 years, but they've still not finished to get to that point of applying for ST4. Whereas IMT is also 3 years. So I tell people, even if you want to do this unconventional path, apply for IMT on the other hand. If you go to IMT, all well and good. If not, then you continue on this path. Because IMT is really structured, and it allows you, like, things are already there, specific requirement that even if you do the bare minimum, at the end of the day, you can still use that to apply for ST4, so that you get signed up. So that's the other pathway, definitely, but it just requires you to be intentional about it, to know all the things you need to do to get signed up, and actually speaking with your supervisor so that they can support you. Yeah.
That's perfect. We'll come back to the questions, because I see that some more have come up, just so we can do this part before we round up in a few minutes. So Thriving in the NHS is a community for international medical graduates. What we do is to bring knowledge to you so that you can thrive in your life and in your career. So we bring people who have more experience, and we share that with each other. So what we do at the moment is several ways for you to engage with Thriving in the NHS. You can explore all our platforms on socials, as well as engage with our newsletter. If you'd like to receive encouragement directly into your inbox, you should sign up to the newsletter. People who've read the book have thoroughly enjoyed it and found it useful for their journeys. Explore the YouTube channel for replays and other information. Instagram, read the blog. The website is coming soon. So what we're looking to achieve next year is we're going to have a community where all of these things that Dr. Ajayi has talked about will be things that we are doing within the community. So we're supporting each other in specialty groups. We're supporting each other through mentoring. We're organizing teaching within ourselves. We're getting those certificates, generating them because we're teaching each other. So if you want to be sort of an early adopter of that community, then please make sure that in your inbox, our emails aren't going to your spam, and you can see them and you're staying abreast of everything that's happening. We'll go back now to the meeting, and we'll just get Dr. Ajayi back so that we can answer the questions that have come up. So one of them I saw is, let's just go back. The e-portfolio, how to go about it. This is a very good question, because a lot of people don't even know what an e-portfolio is. You just keep getting portfolio.
Thank you so much for that question. So an e-portfolio basically is like an electronic record of where you just keep evidences of what you've done. So there's so many types of e-portfolio, but if you're in a training program, automatically you'll be asked to get e-portfolio. But if you are in a non-training program, there's some e-portfolio like OROS, there's the JRPTCB portfolio. For non-trainees, I can share the link in the comment section, where you can even subscribe to that. I think the last time was it 120 or 180 pound. If you are planning to do internal medicine, then easily this will be very good. So I will just share this link. I will just share that where you can always speak with your supervisor. Sometimes the study budgets allocated for that. And then easily you can get your e-portfolio, but it's really good. Then e-logbook as well. So when someone is training in Nigeria and your consultant doesn't have a car, you can create the logbook yourself. So even now that I'm in training, that they've told us that this is a way to do it. So I create Excel spreadsheets. Of course, it has to be anonymized. So I put, okay, patient I've seen on calls, patient I saw during ward run or clinics. Then I put that. Then I then say maybe so and so date. You just 71-year-old female presenting complaint, diagnosis management, and so I create that logbook myself, and spreadsheet. Of course, you don't put the hospital number or the name, but that way you keep track. Because for us, for me in training, like our TPD, so before ARCP, wants to see all the summary, the number of patients. So for us, there's a minimum number of patients expected you to have seen. So you can create that, e-logbook by yourself with an Excel spreadsheet. And for the e-portfolio, now if you're in Nigeria, even if you don't want to pay for this, you can always search online and print out. There are a lot of the, for instance, you've done a teaching, you can print out teaching feedback form, or even create a Google feedback form yourself and send it to them. So at least that stores. Then if you've discussed a patient or you've run a clinic session or you've seen an interesting case and you want your consultant to give you feedback just as evidence, you can always print it out online and just a feedback form. It will tell you feedback form for procedures, feedback form for this, and you can always sign it. And if it's just teaching, you can always, generate there are a lot of feedback form templates that you can use. Yeah.
Thank you. Someone has asked how to follow us. So I'll let you go first on social media.
Yeah, so on Instagram, I'm not sure I can share the link here, but I can always just put my name where you can just search. I'll just type that at Dr. Efelia. That's the Instagram handle. And for the blog post, I will share the link as well in the comment section, where easily you can just follow. And yeah, read so many of these other things that I've said on the blog post. And then via that, you can get through to the Twitter as well. I'm on Twitter and also on Instagram. Yeah.
Okay. You can follow us on Thriving in the NHS. So across platforms, it's Thriving in the NHS. Okay. I think let me just have a quick look through. That may be all the questions.
I think there's a
I think there's
question.
one on GP. So someone is wanting to know if they can take the competencies that they get from hospital postings in GP and transfer it to applying for ST4.
So they're completely different pathways. So you can't transition from GP to ST4 of the medical specialty, because the requirements and the competencies, even if you gather other things, but what you're expected to get signed up for is not fully incorporated in the GP training. So they wouldn't be able to sign you up to say you can then use that to apply for ST4. If that really answers. So you can't transition from the GP, even after you've completed GP, to then use that to apply for ST4, because they're just completely different requirements and competences. Yeah.
Okay. So there's one message. Someone is in Nigeria, about to start residency in Nigeria. Is it possible to build the portfolio in Nigeria whilst preparing for MRCP, or is it a disadvantage to be in Nigeria?
It's not a disadvantage at all. So I remember when I was preparing for the MRCP exam and I used to go to library, one of the person that we met in library, we are still friends. So I remember that day. So the library closed, like, of course you have out of hours access. So I was there till like 11 midnight, and we had only 2 people remaining there. And the other person was a Black female. So she walked around. And she just walked around. She was like, "Oh, are you also preparing for so-and-so exam for MRCP?" I was like, "Yes." And then we got talking. She was also prepared. So she was a cardiology registrar in Nigeria, I think in OAU then. I think was about to finish. Then before she came to the UK. And so initially she got, but of course that time she had already gotten most of her echo, most of the things, and she was able to keep all the evidence. So by the time she then came to the UK, I think she worked as an SHO for maybe 6 months, so that time she did her MRCP exams, then was able to get a non-training cardiology registrar job here, so that then she worked in that role for a year and just fine-tuned her portfolio, and now she's now ST4 cardiology. So she was then able to apply and get into cardiology training here. So it's not a disadvantage, because obviously, if whichever specialty you are back home, you know, you're already, in fact, I'm telling you, you would have done more than most of the trainees here. But it's about making sure you keep that evidence, you gather evidence portfolio. Oh, you are running clinic session, maybe you're respiratory, you've been like running clinics, you've been drawn, maybe you've not been doing bronchoscopies, but you've been like running clinics, TB clinics, this thing, lung cancer, on calls, all of that. Make sure you have evidence, you keep a logbook, you have a form you can fill where your consultant can give you feedback and say, okay, this person is competent in doing this and this person has done this and this. You make sure you are just collating feedbacks and just building your portfolio, because everything will go a long way and be relevant. So far, you can evidence this and keep portfolio. Maybe by the time you are leaving, your HOD or one of your consultant can give a written, recommendation and say, Dr. So-and-so has been with us for so-and-so, he's done his residency, during this time, he has been independent with this, and this, and all of that. So it's not a disadvantage.
Thank you so much for that. So I've scrolled through, I think those are all the questions that have come through.
Yeah.
The question about family planning around training, you've answered as well. So I think that's everything. Oh, someone is asking about balancing rest.
Balance rest with what?
You mentioned that.
So, I mean, it's about number one, you need to be able to say, okay, you definitely need rest period. The good thing with the UK is that you have, the European working hours where, if this is the maximum number of night shifts you can do in a week, this is the maximum number of long days. You must have maybe 0 days before night, 0 days. So the way basically I try to prioritize rest is that, of course, I have so many other things I'm doing. It's just I go based on my rota. I already know my rota maybe for this next 6 months. I know my off days. I know days I have 0 days. I know days that I'm on calls, and maybe weekends that I'm free. For instance, this weekend, and I know, okay, I want to do grocery shopping, I want to do laundry, or I want to rest, I want to sleep. And then some days I might take annual leaves in between, like if I see that I have block of night shifts or on calls that is like back to back, and I just like, okay, I need a breather in between. I can apply for some annual leaves, take some rest during this time. As a female, most time weekend I do bulk cooking, or sometimes I even might need to just, sometimes pay someone to just, if I'm really busy and I don't have time just to do the cooking. But it's about really prioritizing rest. Of course, if you have a family, trying to also plan for activities, going out with the family and all of that. So also incorporate that to just to be able to just find that balance. And if you're in the UK, there are so many opportunities of going less than full time. You can decide I only want to work 4 days a week, 3 days a week, so that you have 0 days, which is fixed. And then, that can also really just help with rest and balancing things if you need to do that. Yeah.
Thank you very much for sharing that. I'd like to thank everyone again for coming. Very, very, very special thank you to Dr. Ajayi for this very insightful, powerful, information-packed session. We are coming to the end of the session. I think there's one question that just popped in. Our next session is going to be in December, where we're going to take time to plan for next year. If you stay connected with us across platforms, then you'll get all the information. We're doing it as a vision board exercise. So if you've ever heard of vision boarding, it's where you take pictures, cut out pictures of things that you want to achieve, and you put them on a board that you can see, and that keeps you goal oriented. And we'll do that with the year as well in mind. So you can put things like your exam dates, when you're going on annual leave, just to rest somewhere fancy, all of that. We'll send messages to let you know when it'll be, what you need, how to prepare. So stay connected with us for all of that. Dr. Ajayi, do you have time for the last question before we go?
Yeah, so just compare, decided to specialize in internal medicine, start preparing. Yeah, definitely. Obviously, if you can start preparing, do that. I know some people as well who did that because they did their MRCP 1 and 2 maybe before coming to the UK, or even some did they were able to get, Ghana also now offers, you can write to MRCP PACES in Ghana now, so which is close to Nigeria. So I know people that they were able to do all their MRCP exam before they even relocated to the UK. And that puts you as an edge. And now, even if you go via the MRCP route, you can use that for your GMC registration as well. So it's like, using, you know, one stone to kill two birds, because by the time even you're applying for jobs, they can say, oh, this person has MRCP, so you even be at a better advantage. So yeah, definitely you can do that.
Thank you for the time. Is there any other specialty I can gather their competencies during my GP training since IMT is out of the way? I think so. I think from what I understand about this question, I think this person has got into GP training and it's clear in their mind they don't want to be a GP, but they want to swap over to something else. So I think the important thing is recognizing what your something else is. And then, so I'll leave it with you, Dr. Ajayi.
Yeah, so if you're planning to do IMT or any other specialty while you're in GP, I think what you will have to do most likely, now the competencies you can gather, obviously you can build your portfolio, don't get me wrong, during your GP training. So for instance, if you've now identified you want to apply for emergency medicine or you want to apply for IMT, now I think this person that asked saying they will have respiratory rotation and all of that. During that time, you want to maximize it. So you'll be in respiratory. You want to like, oh, can I, you know, be supervised for pleural tap? Go, can I attend respiratory clinics? Can I do teaching? So because you already know the end goal, that while you're at this rotation, apart from just do your GP training, you also got trying to build your portfolio to then apply. Or if you're going to have ED rotation, while you're ED, if you plan to apply for ACCS emergency medicine, you know that, okay, oh, I'm going to be, maybe I want them to supervise me for nerve blocks. I want them to supervise me for ultrasound. I want them to supervise me for this. And you start building your portfolio. So you can always still build your portfolio. But at the end of the day, you will have to then reapply to whichever specialty you then decide to do aside the GP training. Yeah.
I hope that answers the question. We thank Dr. Ajayi again for making this such a wonderful session. Thank you. Thank you again to everyone. Thank you so much, Dr. Ajayi. God bless you.
Yeah, thank you so much.
Have a lovely weekend, everyone. Hopefully we'll see you at the vision boarding and we'll engage more when we're all a part of that community where we are creating our own network to support each other. Okay.
Thank you so much for inviting me and for having me. Yeah, thank you. Bye, everyone.